Hello everyone, this is Johnny Joe Landis again, and today I'm going to be discussing 4 responses from my peers for the questions that we were prompted for this week. The first question that I'm going to go over deals with how do we expect to talk to our patients about trauma as a future healthcare professional. I chose one of my peers, Allison Otto, to start this one off, and she talks about a quote from the book that discusses how Jane had this gut feeling that she needed to talk to one of her patients about moving up their appointment because she felt like something was about to occur. Now, she didn't say exactly what that was, or he didn't either, but when they exchanged words, it turned out he did feel that he needed to see her earlier. And I think where she was going with this is that you need to listen to your patients, read them, and know them enough to think on a different level even when they're not around. And I agree, because that's something that keeps you connected to the patient in such a way that you can address their problems, especially when they arise, or at least to prevent them. The second one that I want to talk about deals with the question about which quotes we saw from the story that we liked, and why do we like them, and how do they pertain to the passage that they were on. Adriana Woodridge had talked about the quote that states, "He was too old, not old in years, but in other ways he was old from too much life, old from seeing too much, old from knowing too much. He was tired and broken, walking with a cane and passing blood, and he knew it wouldn't be long for him." And what this one is addressing, from her perspective, is, and I agree, is that PTSD, amongst other trauma-induced illnesses, tend to cause physiological problems as much as they do mental health problems. And this is something that seems to be the narrative for most of the stories in the book, but this passage emphasized it more if it wasn't already obvious. And I think that's great, because that's something that's core to understanding your patient, is knowing that the mind and the body are not separate. And the next one also is a quote. It talks about America's addiction to painkillers is as great a threat as terrorism. And that one was brought by April Delgado. And she starts to talk about Tammy. She talks about the medications that were overprescribed and abused. But if I could add to it, I would like to state that I think what's more important is that they were masking who she really was. And by doing so, they couldn't progress in her treatment. So to undo that, we need to figure out a way to not prescribe so much and advise patient on healthy habits of using the prescribed medication. And the fourth and last one comes from a peer of mine, Alexa Aceves. And she used the quote, "If a woman cannot be safe in her own home, then she cannot be expected to feel safe anywhere." Where I agree on this is where she starts talking about the advocacy for women to speak up more, use their voice more, and reach out to those that will help them, because there's plenty of people that will. But I think that what she does add to it is that sometimes it's hard for these women to do so, especially in Jita's case, which is who she brings up. If I can add to that, I think it's more than just the comfort at home. Jita was isolated from every aspect of her life. She didn't go to the doctor alone, she didn't go to the mall alone, she didn't go to the restroom alone, it seemed like. But she eventually, after so many sessions with Dr. Jane secretly, and finally reaching out to her family, realized that the help was always there. She just needed the courage to do so, which Dr. Jane helped her find. Well, those are the 4 responses for this week. Thank you for listening.